Everyone, welcome back to my YouTube channel. So some of the questions that came in today's exam I'm going to recollect here. A male patient had urethritis. What would be the cause? So out of these, if you were to ask me, gonococcus is the most common cause. I would have gone for that. Now HIV drug that acts against both CCR5 and CXCR4. So basically attachment inhibitors. So earlier it was thought that maraviroc acts against only CCR5, but recently they've said that it acts against CCR4 as well. So maraviroc is the right answer here. But other than that, there are drugs so attachment inhibitor, we only have one. Even if you know that it is used for CCR4 or CXCR5, even if you remembered one of those, you could have answered this question. Anyways, penetration inhibitor is enfuvirtide. Now integrase inhibitors have gravir at their end. So dolutegravir, eltegravir, raltegravir, and all of that. Now protease inhibitors have navir, and there are NRTIs and there are NNRTIs. Besides that, there are other drugs as well. Now another question which I think is something that I can help you with is which vacutainer is used for HbA1c. We do not want hemolysis, so we will go for a vial that has an anticoagulant and we'll go for EDTA. Now, which is not a feature of cystic fibrosis. So the thing is, cystic fibrosis can cause nasal polyps by obstructing all glands and all by secretions. It can also cause meconium ileus by the same mechanism. It can also cause bleeding diathesis because biliary bile acids and all won't get secreted from the liver, and absorption and all won't be proper. Vitamin K would not be absorbed properly. The entire this thing would be affected. But there is no reason per se for a biliary atresia here. That is something that I'm sure of. Right thyroid swelling, I don't know what was asked, if no lymph node is involved and if the swelling is singular, and probably, if I'm not wrong, if it is less than 4 centimeter, that is T2B or something, I do not remember. So you'll have to give me the size, but I think if it's less than 4, then you can skip excising it. In toto, you can just go for a partial excision, so you can go for a lobectomy. So it depends on the size. So if you can recollect and if you can help your fellow batchmates in the comment section, it would be great. Now components of Anemia Mukt Bharat is, you have 6 beneficiaries, 6 interventions and 6 institutional mechanisms, but there are no 6 diseases. It's just anemia that we'll be talking of. Now again, this question I'm not very sure of it. Woman with abdominal pain and ovarian cyst which is 6 into 4 centimeter, what would be the next size? What would be the next step? So I just remember Deepthi ma'am teaching us that if a tube ovarian mass is less than 10 centimeter, you are not in a hurry to excise it. So you do not have to excise it basically. And then I think depending on the age, the answer would vary. But as per my common knowledge, ovarian cyst can also be a ruptured corpus luteum cyst, and corpus luteum can be very big as well. So I would go for a follow-up in this case because every female has a corpus luteum every month. Yeah, that was all for the recall, but you guys can let me know more questions and I can make like a better recall then.